Difference between herpes, pimples or genital grains? Genital herpes and genital pimples have similar characteristics, which often appear as small lumps filled with pus on the skin. Pimples occur when dirt or oils block the pores of your skin. This causes red bumps filled with white pus accumulated in the pore that appears on the skin. Genital herpes is the result of a sexually transmitted infection caused by the herpes simplex virus. Unlike pimples, herpes bulges tend to be clear or yellow and are filled with a clear liquid. Herpes and pimples share the same symptoms, both can appear as a group of red bumps, both can be itchy and both contain pus. Genital pimples. Pimples can appear one at a time or in small clusters. In general, they are perfectly round and appear in recognizable patterns. If you wear a sports belt or tight underwear, the shins can go where the strap or underwear clogged your pores. Pimples feel firm if you prick or pinch them. They may become filled with white pus that becomes dark when exposed to air. They may also bleed or shed thick white fluid if they become scratched or irritated. Genital herpes. You can have the herpes simplex virus for years without experiencing any symptoms. During a herpes outbreak, you will notice small, regular, painful blisters filled with clear fluid. The blisters may appear in groups and may also appear in your rectum and mouth. The blisters tend to feel soft. Other symptoms of an outbreak may include headaches, pain, swollen lymph nodes, high fever of 101 degrees Fahrenheit or higher, and pain or tingling in the legs. When herpes blisters break, the fluid will spill and may cause more pain. The blisters may not heal for 4 weeks. You can have an outbreak at any time after contracting the virus. After the first outbreak, the symptoms are usually less severe, but they can still be painful. Grains in the vagina. The skin of the vagina is very delicate, it is one of the most sensitive parts of the female skin. We should always be aware of any change or irregularity that appears as stain, rash, color change, irritation, allergy, inflammation and pimples. What are the causes of pimples in the vagina? The pimples in the vagina are small pimples that usually appear on the vaginal lips and, although they can be caused by common shaving, they can also be a symptom of the presence of some vaginal fungus. Treatment for herpes, pimples and genital grains. Treatment options vary depending on whether a person has pimples or herpes. Treatment of pimples. In general, it is not necessary to treat the genital pimples with more than good hygiene practices, such as cleaning the genital area more thoroughly or more frequently. Herpes treatment. Herpes treatment, on the other hand, usually requires medical intervention. A doctor will typically prescribe antiviral medications to fight herpes infection. People should take the recommended doses and avoid sexual contact until the outbreak disappears. Treatments of pimples in the vagina. These treatments depend on the cause of the pimples in the vagina, such as folliculitis, vaginal infection, vaginal herpes and HPV.